Good afternoon, viewers. I am Tutor Anita. I tutor at Mulago School of Nursing and Midwifery, and I am going to take you through waste segregation. Okay, so waste segregation is done using different bins, which are categorized differently depending on the category in which the waste belongs. So we are going to start with seeing the different bins according to the different categories of wastes that are in those bins. So we start with the black bin, and the black bin accommodates all the non-infectious wastes, and that is the dry ones and the wet ones. So the dry ones are those that are dry. So we have peppers, okay? We have peppers, we have empty bottles for drinking water. Those will go there, and now that is wet, non-infectious. So we can also have the food remains and all that. However, if these dry and wet non-infectious wastes are from a patient who has very infectious disease, then they will go in a different bin, which we shall see that accommodates the highly infectious wastes. Okay, so that is all with the black bin. Yellow bin, and the yellow bin accommodates the infectious wastes. So the infectious wastes are all those things that are from a patient, have been used on a patient, and do not have blood or any human remains or body parts or particles. So among them can be a giving set, a fluid giving set. We can have urine bag, okay? We can have a urine bag. We can have a catheter in it. We can have an NG tube into it, and all the other wastes that are infectious. However, remember we said that if it is from a highly infectious patient, we shall have it in the highly infectious bin. So this is only for the infectious wastes. The highly infectious bin, which is the red bin. So in the red bin, we have the body parts. Among them, we have the placentas, we have human tissue. In case you're cleaning a wound and you're debriding it, you will have to put them in the red bin, and any other thing that has blood. So handling any of these wastes need you to have gloves on. So we shall always have gloves because it's our protection first. So, and among them we have the clean gloves and the surgical gloves. Now when you're handling blood or any human part that you need to dispose of, you will need to have surgical gloves on because they are stronger and able to protect you from any infections that may be in that waste. Okay, so you're going to put on surgical gloves and you put them on well. Okay. So, like we said, that this is dry and it will go into the dry or in the non-infectious bin. So, in the highly infectious, we said that we have anything that has blood. So, a blood giving set like this one will go to the red bin, right? And any other thing that has blood will go into the red bin. Okay? So even when you finish handling blood, like I have handled the blood, I will need to remove these gloves well, taking care that you do not infect or splash any of the secretions there, and then you will put it in the red bin. The pharmaceutical wastes include the vials that are empty, the expired drugs, and any other pharmaceutical thing. Even the laboratory reagents can be put in the brown bin. So, and those wastes are called toxic wastes, right? So by vials, the empty vials, now these are vaccine vials that are empty, and so they will be taken into the brown bin. These are containers of expired drugs, and they will be put also in the brown bin. Okay. So now in a scenario that those vials, or for example like this, is broken, you will not put it in the brown bin, however much it is a pharmaceutical waste, because it is going to now affect the person that is going to dispose of these wastes that you have. So you're going to put it in a safety box. Now the safety box accommodates the sharps and the broken vials or broken pharmaceutical containers that you may have. So after you have cannulated and you have a sharp, you will take it straight into the sharps box or safety box. So, and you have to ensure that you do not recap. So for example, you have drawn blood from a patient and you have the syringe with you. Remember, you have a cap of this needle. Do not recap, because that is going to expose you to have needle stick injuries. So you're going to take it straight into the safety box. Okay. Now, in a scenario where you have a container that you have given to a patient to put in a sample for you, and you have finished to use that sample, you will need to dispose it off into the highly infectious bin. So in case there's sputum in here or urine from a highly infectious patient, you will put it in the red bin. All right, so that's all that we had for today, and thank you very much.